Did you know that nearly half of postmenopausal women experience vaginal dryness? Yet for so many, it remains a topic shrouded in discomfort and silence. Here's the truth. There's no reason to feel embarrassed or alone. This isn't just about intimacy. It's about comfort, confidence, and reclaiming control over your body as you age. In today's video, we're pulling back the curtain on vaginal dryness. We'll uncover why it happens, debunk myths about supposed solutions, and explore what really works. Whether you're looking for quick relief, long-term management, or simply trying to improve your daily comfort. Here's the thing. Vaginal dryness doesn't just affect physical well-being. It can also chip away at emotional confidence, disrupt relationships, and make simple things like sitting or walking uncomfortable. But the good news is that there are effective, scientifically backed ways to address it. By the end of this video, you'll have practical, straightforward solutions to improve your quality of life. We'll discuss everything from everyday moisturizers and lubricants to hormonal therapies, diet tips, and lifestyle changes that can make a big difference. And if you've ever been tempted to try a miracle cure you found online, don't worry. We'll also explain what to avoid so you don't waste time or money. So grab a cup of tea, find a comfy spot, and stick with me to the end. Not only will you walk away with actionable advice, but you might also feel inspired to start an open conversation, whether with a friend, partner, or doctor. Remember, your comfort matters, and your health deserves attention. Let's navigate this journey together, without shame or judgment. If you're ready to feel empowered and informed, let's dive in. 1. What causes vaginal dryness? After menopause, vaginal dryness after menopause isn't just a random occurrence. It has a clear biological cause rooted in hormonal changes. Menopause marks the end of a woman's reproductive years, leading to a significant drop in estrogen levels. Estrogen plays a vital role in maintaining the health of vaginal tissue, keeping it thick, elastic, and naturally lubricated. When estrogen declines, the vaginal walls become thinner and drier, making even everyday activities uncomfortable. This isn't just about intimacy. Simple things like sitting, walking, or wearing certain clothing can lead to irritation or even pain. Unfortunately, many women avoid addressing these symptoms, either out of embarrassment or the belief that it's just an inevitable part of aging. But here's the truth, it's common, yes, but that doesn't mean it has to go untreated. Other factors can also contribute to dryness. Stress, for instance, can wreak havoc on your body, and vaginal health is no exception. Medications like antihistamines, antidepressants, and certain cancer treatments can exacerbate the problem. Even lifestyle choices, such as smoking or not staying hydrated, can play a role. One thing that often surprises women is how dryness can impact emotional well-being. When intimacy becomes uncomfortable or painful, it can create distance in relationships. On top of that, women often internalize these changes as a loss of femininity or vitality, but nothing could be further from the truth. Understanding the cause is the first step toward finding solutions that work for you. By acknowledging this as a natural change, rather than a taboo subject, you're already taking a powerful step forward. Don't let myths or silence stop you from exploring treatments that could significantly improve your quality of life. 2. What doesn't work? With so many supposed remedies floating around, it's easy to feel overwhelmed or misled. Let's bust some myths and save you time, money, and unnecessary discomfort. First, beware of home remedies touted as natural solutions. Coconut oil, olive oil, and aloe vera are often recommended, but they can disrupt the vaginal pH balance. Your vaginal microbiome is delicate, and using the wrong products could invite irritation, infections, or even bacterial vaginosis. Over-the-counter lubricants can also be a mixed bag. While they're widely available, Many are loaded with ingredients that postmenopausal women should avoid. Fragrances, dyes, parabens, and glycerin are common culprits that can irritate already sensitive tissues. Instead of providing relief, these products can worsen the issue. Another misconception is that drinking more water alone will fix dryness. While hydration is essential for overall health, it won't directly solve vaginal dryness, which is primarily hormone-related. Perhaps the most harmful approach is ignoring the problem altogether. Many women feel too embarrassed to seek help or assume that vaginal dryness is a normal part of aging they must endure. But silence can lead to missed opportunities for effective treatments and may prolong discomfort unnecessarily. It's also worth mentioning that there are no quick fixes. Miracle creams, herbal supplements, or DIY concoctions may promise the world, but they're rarely backed by scientific evidence. Worse, some of these products could pose risks or interfere with your body's natural healing processes. Finally, societal taboos often discourage open discussion about these issues, leaving women to rely on unreliable information. That stops now. Understanding what doesn't work clears the path for solutions that truly do. 3. What works? Proven solutions. Now that we've debunked the myths, let's focus on what truly works. Effective management of vaginal dryness is about combining the right products, treatments, and habits tailored to your needs. Start with vaginal moisturizers, a go-to solution for many women. These aren't the same as lubricants. Moisturizers, like Replens, provide long-lasting hydration and improve the elasticity of vaginal tissues. They're applied a few times a week, much like a facial moisturizer, and can make a noticeable difference in your comfort. For intimacy, lubricants are essential. Opt for water-based or silicone-based varieties. Silicone-based lubricants, such as Pure Med Premium Glide, are particularly effective because they last longer and provide a silky texture without irritation. Always avoid products with fragrances, glycerin, or alcohol to minimize sensitivity. For those with severe dryness, vaginal estrogen therapy is a game-changer. This involves low-dose estrogen applied directly to the vaginal area via creams, rings, or tablets. Since it's localized, the risks associated with hormone replacement therapy are minimal. Discuss this option with your doctor to determine if it's suitable for you. If hormones aren't an option, hyaluronic acid-based products like Reverie are excellent alternatives. These non-hormonal treatments mimic the body's natural lubrication and are backed by science. Beyond products, pelvic floor exercises can boost blood flow to the vaginal area, enhancing natural lubrication and improving tissue health. Kegels are a simple but effective way to strengthen your pelvic floor muscles. Combining these treatments with lifestyle adjustments, such as avoiding irritants and staying hydrated, will maximize results. Finding the right solution might take some trial and error, but the benefits are worth the effort. 4. Lifestyle changes that make a difference. Managing vaginal dryness doesn't stop with products or treatments. It's also about creating daily habits that support your overall health and well-being. Small, consistent changes can have a significant impact. Hydration is one of the simplest yet most overlooked steps. Drinking enough water keeps your body hydrated, which indirectly benefits your vaginal tissues. Aim for at least 8 glasses a day, and pair this with a diet rich in water-packed fruits and vegetables, like cucumbers and melons. Nutrition matters too. Foods high in omega-3 fatty acids, such as salmon, walnuts, and flax seeds, support tissue health and may improve natural lubrication. Soy-based products like tofu and edamame contain phytoestrogens, plant compounds that mimic estrogen in the body, offering a mild hormonal boost. Exercise isn't just for your heart or waistline, it also benefits your pelvic health. Activities like yoga and walking improve blood circulation, while pelvic floor exercises strengthen the muscles that support vaginal tissues. Avoid irritants like scented soaps, bubble baths, or harsh detergents for your underwear. These can strip away natural oils and upset the vaginal pH balance. Instead, choose mild, fragrance-free products designed for sensitive skin. Stress management is critical. Chronic stress can disrupt hormone levels, worsening dryness. Practices like meditation, deep breathing, or spending time in nature can help lower stress and improve overall health. Finally, make time for intimacy. Whether through partnered activity or self-stimulation, regular engagement helps promote blood flow and maintain the health of vaginal tissues. Intimacy shouldn't feel like a chore. It's a natural part of life that can enhance your emotional and physical well-being. By incorporating these lifestyle changes, you're not just addressing vaginal dryness, you're fostering better health overall. 5. Don't forget to talk to your doctor. It's easy to feel overwhelmed by the options, but remember, you don't have to navigate this journey alone. Your doctor is a valuable ally in finding the best solution for you. Open communication is the first step. Vaginal dryness is a common issue that healthcare providers discuss regularly, so there's no need to feel embarrassed. Start by describing your symptoms, how long you've experienced them, what makes them worse, and how they're affecting your daily life or relationships. Your doctor can help identify the root cause. While menopause is the primary factor, underlying conditions or medications might also play a role. Understanding the full picture ensures a tailored treatment plan. For many women, a combination of treatments works best. Your doctor might suggest vaginal estrogen, non-hormonal options, or over-the-counter products based on your preferences and medical history. They can also guide you on proper usage and dosage. If you're concerned about side effects or have pre-existing conditions, don't hesitate to ask questions. A good doctor will address your concerns and provide reassurance. Remember, it's about finding what works best for you. In addition to treatment, your doctor might recommend follow-ups to monitor your progress. Vaginal health is an ongoing process, and adjustments may be needed as your body changes. Taking the initiative to speak up about vaginal dryness is an act of self-care. You deserve to feel comfortable and confident in your body, and seeking professional advice is a vital step toward achieving that. 6. Emotional aspects. You're not alone. It's essential to understand that you're not alone in experiencing vaginal dryness after menopause. Research shows that millions of women go through the same thing, even if it's rarely discussed openly. The emotional aspect of this condition can sometimes feel more challenging than the physical one. Women often feel a deep sense of loss of intimacy, femininity, or even control over their bodies. These feelings are completely valid. For some, the inability to engage in sexual activities due to discomfort can make them feel less attractive or desirable. It's easy to fall into the trap of thinking that vaginal dryness defines you, or that it's something you have to live with in silence. But this couldn't be further from the truth. It's a temporary, treatable condition that doesn't take away from your worth. As much as it's about the body, it's just as much about your mind and emotions. One of the best things you can do for your emotional health is to practice self-compassion. Be kind to yourself and acknowledge that these changes are a natural part of aging. Just because your body is changing doesn't mean you've lost your sense of self. Embrace these changes as opportunities to explore new ways of nurturing your body, spirit, and relationships. Aging doesn't mean losing your identity. It's a chance to grow into a more empowered version of yourself. Moreover, opening up about vaginal dryness, whether with a doctor, a close friend, or even your partner, can lift the emotional burden. It's an opportunity to break free from the shame or isolation that often accompanies these issues. A good conversation with someone who understands or is willing to listen can make a huge difference in your emotional well-being. Remember that maintaining a fulfilling emotional connection with your partner doesn't solely rely on physical intimacy. Exploring new ways to bond, whether through conversation, non-sexual touch, or shared activities, can help reinforce the emotional aspect of your relationship. You are so much more than just your physical condition, and so is your relationship. Taking care of your mental and emotional health during this time is just as important as addressing the physical symptoms. By acknowledging the emotional weight of vaginal dryness and reaching out for support, you'll find that there's a whole community of women who understand and empathize with your journey. You don't have to suffer in silence. Help is available, and it's okay to ask for it. Now that we've covered the essentials, I want to hear from you. Have you tried any of these solutions, or do you have a tip that's worked wonders for you? Drop it in the comments below. It might just help someone else. And if you found this video helpful, don't forget to like, share, and subscribe for more advice tailored just for you. Let's continue breaking the silence and supporting each other. Remember, it's never too late to prioritize your health and happiness. Thanks for watching, and I'll see you in the next video.